He tried calming her down. She started yelling at him saying, "I wanted my meds, but they wouldn't give em, now I'm gonna give em some titty." Psychiatrists have read it. What was the most obvious attempt to fake insanity you've seen? Had a mother come in and insist that her child had Silver-Russell syndrome. You can go read on it. It's not that easy to fake, as it's a bunch of metabolic conditions mixed with congenital abnormalities. The kid was small, but not that small, around 6th percentile. He didn't weigh much, 5th percentile. All of this, with a right arm length 2 centimeters more than the left side, were borderline criteria for Silver-Russell. Did genetic testing, which came back negative, but 30% of cases are negative. So the deciding factor was one of the soft criteria of hypoglycemia. Once she heard about this, she printed out 30 to 40 articles on the disease. She came back with the kid in a coma. But when the kid was in the hospital, he was never hypoglycemic. He went home, and came back in a coma a few weeks later. Again, as soon as he was eating normally at the hospital, he was never hypoglycemic. She starved her child into comas repeatedly for the diagnosis of Silver-Russell. She was also a boog on people who live off welfare and make a game out of it. By the way, she was in a wheelchair when at the hospital. Once I had enough of her bullcrap and walked into the room after only knocking once. She was walking around normally and jumped into the wheelchair as soon as she saw me. I believe it was for money, since in Canada, you get money when your child has a genetic disability. God, if it was legal, I would have slapped some sense into that bitch. Gypsy Rose Blanchard was a pretty famous victim. If you haven't heard of her, do a quick Google search of her name. Basically, Gypsy Rose's mother Dee Dee convinced doctors that she had all these developmental and physical issues, including allergies to sugar. Gypsy was forced by her mother to always be in a wheelchair, and when her mother caught her sneaking to the kitchen, walking just fine on 2 feet, to get sweets and soda, her mother would actually tie her to the bed with a silk ribbon to make sure she didn't escape. In 2014, if I remember correctly, Gypsy Rose and her online boyfriend of 3 or something years murdered Dee Dee. Gypsy Rose felt like that was the only way to finally be free. It's an incredible story and a just as incredible show by Hulu called The Act. I highly recommend it to anyone who loves true crime. Not a psychiatrist, but a secretary for a PISH ward at a Veteran Affairs hospital as a college student, who was also trained to be part of the takedown team. So when a patient gets unruly and non-compliant, we're sent in to safely get them restrained. One day I came into work expecting it to be a normal day. I immediately heard the code over the comm system for the takedown team to come to room 3. Room 3 is the intake room and where all new patients are seen. We arrive in the room to assess the situation and there are feces spread on the walls, and a man rubbing it all over his chest, completely naked. We managed to get him restrained without too much hassle, and we are all covered in feces at this point due to him fighting us at first. We get done and him restrained and the doctor on the team asks him, "Why did you feel the need to rub feces all over?" His response? "I'm homeless, the US government won't take care of me and I want food and a place to stay. The shelters are full and I knew that I could get at least 72 hours of warmth and food by acting crazy." We gave the man a full 2-week treatment stay instead, and had the VA and DAV come in to get him housing. Literally one of the best patients I've dealt with while working there from that point forward. Even helping to calm other vets down on the floor before we had to do a takedown. It's absolutely atrocious that these veterans feel the only way they can get the help they need is to do something this extreme. Last I heard the guy was doing much better. DAF helped him get a job doing cleanup at construction sites and an apartment of his own. Did a psych placement as a student and was in a discharge meeting with this homeless guy. He was brought into the hospital because police had been called as he was threatening to jump off a bridge. He claimed depression and suicidal thoughts, which it was found out not to be. So he said he was hearing voices, which was also not true. Dude was just desperate to have shelter and food. Sad case. Psychologist, not psychiatrist, but I used to work at the VA as a trauma psychologist. My job had nothing to do with whether people got service connected. That was an entirely different process. That said, a small minority of people thought if they could trick me into diagnosing them with PTSD, they would be rolling in dough. They would not have been. The most blatant version of this was someone who had clearly found that same criterion online and tried to parrot it back to me without knowing at all what the symptoms meant. At one point this person told me they have hypervigilance. Hypervigilance. When I asked them to give me an example, they looked like a deer in the headlights. I want to stress how small a minority of people this was. Most people I worked with, 1, really did have PTSD, 2, were extremely distressed by it and had it affecting their lives immensely, and 3, wouldn't actually file for service connection because they didn't think they deserved it. I think veterans get a lot of flack for filing spurious claims for service connection, but on my side it was a very, very small minority who were trying to pull one over on people. Most of these men and women just wanted to feel better. Trisha Paytas clearly has something going on, but I don't think it's any of the things she's claiming. I'm not just saying that flippantly either. Being uncomfortable with not being the center of attention at all times should be enough for a general physician or psychologist to be asking more questions. I'm a student in a forensic psychology course at my college, and our professor instructor is a clinical forensic psychologist. Man, it's the most interesting thing. She'll tell us about the meetings with no identifiers, of course. One guy she has talked to us about was fascinating. He was sent in for a malingering exam after being held at the state psychiatric hospital after being ruled to be not competent to stand trial. Someone at the hospital had already given him a malingering exam, which they were not supposed to do. So when he got to my instructor, he knew exactly what to do to play off being crazy. Although much to his dismay, the exam asks about false symptoms. So he got caught early on. Was looking under his chair and claiming to see things. Quite the fascinating story. I'm a clinical psychologist, and while dissociative identity disorder is technically considered a disorder by the DSM, it's probably the most controversial one out there. Many psychologists and psychiatrists still argue that against it, and even those who accept it as a disorder will agree that it's nothing like how movies depict it to be. So I've only had the strange pleasure of meeting 2 people who claimed to have DID, but were very obviously influenced by the classic Hollywood and media stereotype. Even if you do consider it to be a disorder as described in the DSM, the other controversy is in terms of diagnosing it. There's not many reliable tests to allow you to do that, and probably more cases of a misdiagnosis or a patient faking it than true cases out there. That's really what makes it so controversial and a diagnosis that at one point every psychologist wanted to give out because of all the attention it would bring them, and now no psychologist would want to give because of all the controversy and speculation that rightfully come their way. My friend who worked in the psychiatric ward at a hospital, one day he was called in to deal with someone who was mentally unfit to be with others. He comes in, finds a 50-year-old woman running naked through the hallways with security guards chasing her. He tried calming her down. She started yelling at him saying, "I wanted my meds, but they wouldn't give em, now I'm gonna give em some titty." She then starts shaking her chest at him. She was quite endowed. I mean, some serious honkers. A real set of bad donkers. Anyway, I'm getting off topic. She gets taken into a special padded room. She was then given her meds and promptly let go. Her mental file said she was mentally competent. Turns out her meds, the ones she had been raving about, she hadn't been taking but was selling. $25 per pill, I believe. And this act was her way to get more. Running through the hallways at a hospital with no clothes on, swinging her massive dob and honkers and not harming a single person in the process of being manhandled by security. Just your average day, I guess. Like and subscribe for more r/ask Reddit videos.